when you take a tooth out, and a dentist takes a tooth out, he assumes that he's gotten rid of all of the infection.
Right.
But you got to remember that there was infection at the end of the root of the tooth that got into the surrounding bone supply. And he didn't get rid of that. And so we have a protocol set up that every dentist should follow when he takes a tooth out, to go in and remove about 1 millimeter of that surrounding bone supply in the bony socket. Otherwise, some of those bacteria will be left there, and the infection won't be gotten rid of at all. It will be still in your jaw.
The only thing gone
Now,
is the tooth.
For a while, they may
Yeah.
be perfectly comfortable, but eventually that infection is going to grow, and it's going to be a big hole back there
Right.
in their jaw, which is called a cavitation. And so that's a whole other factor. And one of the other things I want to bring up, oh, I thought I had the picture of the child here.
Yeah, that's there.
Oh, here it is. One of the things that most parents don't know who have young children is that young children are having root canals done all the time. But generally, they're not called root canals. They're called pulpectomies or pulpotomies or some other name. And the patient goes home and the parent gets notified. They don't think of it as a root canal, because even if they know about root canals, they're not thinking of it in the same terms.
It's a baby tooth.
But that's what it is. It's a root canal.
They do this on baby teeth?
Oh, yes, because baby teeth get infected quicker because they are not as dense as permanent teeth. They get infected quicker than permanent teeth do. And so the reason I'm showing you this picture is that Jerome Middleman and his wife wrote this book, Healthy Teeth for Kids, and what I wanted every person listening to this that has young children to realize that if their children have any infected teeth, then they can cause very serious diseases. And one of the most serious ones that has been reported on a number of cases is leukemia. Now, you all know leukemia is a very serious disease, and yet that is commonly caused by infected teeth. But nobody thinks of it in children, and yet I've got reports of at least 2 or 3 children who have gotten leukemia because of infected teeth.
Well, I've seen that on adult patients, a couple of patients where they had multiple root canals, and you take them out and their white cell count stabilizes and the leukemia goes away.
Yeah. At any rate, this is such an important issue. I wanted to be sure that each of you who have children understand that if they're telling you they need a pulpotomy or something else, ask them a few questions.
Yeah.
Ask them, is this a root canal?
Well, that's the problem, is people won't ask questions.
Yes.